A very warm welcome to everyone on day two of our workshop that is on systematic review and meta-analysis organized by Integrated Foundation Uttarakhand and Integrated Association of Medical Basic and Social Scientists in collaboration with National Institute of Nursing Education, PGI-MER Chandigarh and AIMS Rishikesh. We hope you had an insightful first day and are ready for another engaging sessions today. We are privileged to have among us our renowned guest, Dr. Meenu Singh, Honorable Executive Director, CEO of AIMS Rishikesh. She currently holds additional charge as a director of AIMS Bhatinda and has made remarkable contributions in allergy research, telemedicine, systematic review, and meta analysis. Dr. Singh has been a pioneer in evidence based child health in India, and her exceptional work led to the establishment of ICMR Center for Advanced Research in Evidence Based Child Health at PGIMR Chandigarh. With over 300 publications and numerous recognitions, including being ranked in top 2% Global Scientist 2024 and receiving the Bharat Ratna Dr. Abdul Kalam Gold Medal, her influence in medical research and innovation is truly inspiring. Under her guidance, the Center of Excellence for Use of Drones in Medicines and Department of Telemedicine was established at AIMS Rishikesh, making it the first of its kind in the country. Her expertise continues to shape global research standards as an editor of the Cochrane Library and as a past president of Telemedicine Society of India. Today, she will be guiding us on the topic evidence to policy. Ma'am, we are honored to have you with us. Please proceed with your session.
So thank you very much, Priyanka, for this kind introduction. It's really heartening to see so many people interested in the conduct of meta-analysis and systematic reviews, and also people who want to learn about evidence-based medicine. We know that evidence-based medicine has started, it's a long process because it wasn't that people were not practicing medicine, which was not evidence-based, but a systematic kind of impetus was given to this particular field somewhere in 1994-95 when the Cochrane collaboration was established, and people started thinking that we need to review research before we apply it to clinical practice or to policy. So that is the reason we have now specific methodologies which have developed in the field of evidence-based medicine. So I will now share my presentation. Is it already shared by someone?
Ma'am, you can share your presentation, or if you allow, so we can share.
I think you only share it because I'm having a little bit of a problem in sharing. Yeah.
Yes.
So, okay. So, evidence-based medicine, the definition which has come from McMaster's University, is that this is a science of turning clinical problems into research questions and then accessing, appraising, applying, and auditing evidence from scientific research findings to solve clinical problems. So, this methodology is a bridge between research and practice. Now, this practice can be at the level of clinicians, this practice can also be at the level of policy, because we make decisions about clinical practice and we apply or we elucidate guidelines, and those guidelines are used by physicians, lab lab people, as well as scientists for further making, for further translating these research findings into practice. Can you have the next one? Yeah. So this is a cartoon which says the latest research is to do with what to do with all this research. We know that there are several funding agencies. There are agencies like ICMR, CSIR, DST, DBT, and many international agencies which are producing research, which are funding research. And this research is getting reported in various journals. Now, these journals bring the research articles to the researchers as well as clinicians. And many times there are so many articles published on one single topic that it becomes difficult to believe which topic or which paper has the best applicability or validity. There are so many things which you have to test in research findings before we take it into practice. And that is what is evidence based medicine, because that helps people to apply these research findings into clinical practice. Next. So, this is an interesting slide which we like to show to our young researchers. We know that it is years since graduation which are important. And as the years since graduation increase, you can see that the knowledge about the latest best evidence starts decreasing. And this actually is based on the findings of a systematic review. Next one, just click the slide. Yeah, which was based on number of studies which said that with increasing age you lose, knowledge of best evidence. And this was also based on a systematic review. Hence, it's very important that people who are in practice or who are doing research, they must keep themselves abreast of all the clinical findings which are being produced. And for that purpose, they need to be adept in searching literature, because these days we have electronic databases which give us all the information about a particular topic. And if we use that information, we make evidence based decisions. Next one. So, the story of evidence based practice started with, as I said much earlier, but it was Archie Cochrane who had written this book of random reflections on healthcare. And people started thinking about, you know, uh, people just started thinking about that they should base their decisions on clinical, not just on their experience, but also on research findings. And it was seen that there were so many trials sometimes about a particular thing which had been conducted, and people were not basing their practice on those research findings. So it became important that you systematically review literature and then take these research findings into clinical practice. And following this, next, we had several other doyens of evidence based medicine. Sir Dave Sackett, who was a professor at McMaster University, he also taught at Oxford. And he's the one who gave that definition of evidence based medicine. And then we had Gordon Guyatt, who said, okay, let's call it evidence based medicine. Next one. So, along clinical epidemiology was the book which has quoted these definitions of evidence based medicine. And later on, then we had Sir Ian Chalmers, who was an obstetrician in UK, and he then brought into focus the Cochrane collaboration, and they started somewhere in 1994, 95. And the Cochrane collaboration was absolutely important and was very, very instrumental in further taking to the evidence based medicine. Actually, there are some people who are following me. So I have to keep moving. And so the next thing which has happened was Sir Ian Chalmers, who was actually the, who who actually started evidence-based medicine in UK. Like it had already been started, but he is the one who put into practice many of these uh, concepts which were there. Next one. So this is how Gordon Guyatt, who's a professor in McMaster University, still teaches there, and he's the one who coined this term called evidence-based medicine. Next. And after this, there were several centers of evidence-based medicine which were started, and all these centers have now become are there world over. India also has Cochrane India Network. We have had several centers for evidence-based practice, like the one which we have in PGI Chandigarh. There's one in CMC Vellore, and there are many other Cochrane affiliates who are doing evidence-based medicine at their place. Next one, please. So we started doing these sessions on EBM somewhere starting 2005 in India, when we had a collaboration with Royal College of Pediatrics and Child Health. And that is where we then collaborated and we started these courses. And this group, which consisted of Ruth Gilbert, Stuart Logan, and they all used to come to PGI and teach at these courses. Next one. So this is somewhat the evidence-based practice timeline, and this is what is something which we have been using. Next one. So this is the hierarchy of evidence. You all must have learned it by now, that systematic review and meta-analysis are at the helm of affairs. They are the ones which are the topmost category of evidence, whereas case reports, then observational studies, case studies, even cohort studies are considered to be lower in the category. And when we are grading evidence, at that time, we grade evidence according to the type of studies which are being used. Next one. So, what are the 5 A's of practicing EBM? The first thing is to ask a question. That is the first A. That is a very important part, and that is, what are you going to research about? What is the problem which is at hand, which you are wanting an answer to? Then the next part is to access literature. Next part is to find an answer to that question, and you try to start accessing literature, which earlier was done in the libraries, but now it is done on databases, on computers. And we know that there are several databases which are available, which give us the idea about where to find information related to a particular topic. And after we have accessed literature, is then we start the process of critical appraisal. And for that critical appraisal, we use several tools which are there for a different type of study designs. For example, there are tools for like a CASP tool, which is there for RCT. Then there are tools for assessing diagnostic test studies, for prognostic test studies, for observational studies. And after we have appraised then and analyzed, in analysis comes the meta-analysis, because sometimes you have to pool the results of studies to get a net result or to get a statistical kind of uniformity. And later on, we after we have analyzed and applied the results into our clinical practice, then comes the process of audit, and that is to see whether application of that particular strategy has really benefited the patients or not. Next one, please. So these are some of the tests which are used, and as we know that for reporting of systematic reviews, prisma is one of the components of a systematic review, which is for reporting of randomized controlled trials, that you have to use that. And for reporting of systematic reviews also, you have to give these breakup of prisma, like how you have accessed literature, how many studies were taken, how many were excluded, how many were included, what were the inclusion criteria. So all those have to come to that. Next one. And then we have uh, to assess the quality of systematic review, we have AMSTAR guidelines, which I think people will be talking to you about. Next one, please. And after you have critically appraised a systematic review and you have decided to include that systematic review in your guidelines, the next thing is to grade the evidence. The evidence which has been produced by the systematic review is graded according to the software, which is called GRADE. It is grading of recommendations, assessment, and development of evidence. Next one. So these are various steps, and how one step leads into another is something which is extremely important. Next one. Next one, please. So it actually gives you the risk of bias. If there is a greater risk of bias in a particular meta-analysis or systematic review or even a study, randomized control trial, then the quality of evidence is low. But if the risk of bias is less, then the quality of evidence is better. Next one. And then, of course, these are the recommendations, and this lowering of risk of bias is produced because of inconsistency in the results, indirectness of the results, or imprecision of the results. And hence, whenever the studies are inconsistent, that means if there is a significant heterogeneity which is present, if there is indirectness, if the results are not actually being derived directly from the conclusions, and if there is imprecision, that means if the confidence intervals are wide or if the p values are low, then we say that there is imprecision of the results. Next one. Next, please. This is just an example of summary of findings table in a systematic review. This was one of our systematic reviews in which heated humidified air was compared to control in treating common cold. And summary of findings table is what you get at the end of doing a grading of the recommendations. And you can say that the quality of the evidence can be low, or it can be very low, or it can be moderate, or it can be high. Next one. Then, for the decision of policymakers, sometimes it becomes very important to derive evidence from global, regional, or national perspectives. And some people like to do disease burden studies, and these disease burden studies tell you about the relative prevalence of certain infections. For example, in this case, it was respiratory syncytial virus infection in young children, and a systematic review was conducted, and which gave us information that most of the infections that are occurring are viral in nature rather than bacterial. Next one. So this is what the systematic review found, that RSV is a common cause of childhood acute lower respiratory tract infection globally, and also it is a major cause of hospital admissions in young children, resulting in a substantial burden on healthcare services. About 45% of hospital admissions and in hospital deaths due to RSV LRI occur in children younger than 6 months of age. So these are the things which tell us, and that means that you need to focus on research on RSV. Maybe you need to develop a vaccine for this particular virus so that we can eradicate this infection. Next one. Then there was another systematic review, a Cochrane review with antibiotics for community acquired pneumonias, which was conducted by the AIMS Delhi group. And this review, in its implications for practice section, wrote that in children presenting with community acquired pneumonia without underlying illness, and where point of care tests for identification of etiological agents for pneumonia are not available, empirical antibiotics may be used. So it tried to rationalize the antibiotic use for community acquired pneumonia. Next one. Then there is this review which was done by Dr. Rashmi Randan and rest of the group. I was also part of this review. And this was about vitamin D as an adjunct to antibiotics for the treatment of childhood pneumonia. And this review revealed that there is uncertainty for the use of vitamin D in childhood pneumonia. Next one. So most of these systematic reviews actually lead to development of policy about treating a particular condition. And then we had this systematic review, which is about a diagnostic test, CBNAT, which is expert TB. And this assay for pulmonary tuberculosis and rifampicin resistance in adult was very, very good review, which showed that this diagnostic test systematic review changed the methods for diagnosis of tuberculosis in adults and now in children as well. Next one. Then there are certain reviews which are dehumidifiers for chronic asthma. This review I had done a long time ago with Dr. Nishant Jaiswal, which highlighted the scanty evidence to indicate whether dehumidifiers are of any clinical benefit to patients with asthma. Next one. Then we had a systematic review on the use of inhaled corticosteroids in pediatric asthma, which was an update. And as you know, asthma is a very common condition, and the treatment modalities keep getting modified every year. And GINA comes out with modified guidelines every year, and hence one has to keep doing these systematic reviews to find what additional knowledge has been added in the treatment of this particular condition. So this systematic review had also been done and graded. Next one. Then we had interesting systematic review on nebulized anti-pseudomonal antibiotics for cystic fibrosis. And this was one of the first reviews, Cochrane reviews, which had been done in the field of cystic fibrosis, for which we had been instrumental in developing the methodology of a Cochrane review for cystic fibrosis. And this happened to get published in one of the first initial databases of Cochrane database of systematic reviews for cystic fibrosis. Next one. And this is treatment which is now accepted, and people are using nebulized anti-pseudomonal antibiotics in the treatment of CF. Then there was this review of hypertonic saline for CF, and that also replaced the treatment like DNase is otherwise used in the treatment of CF patients, but now nebulized hypertonic saline has been found to be equally effective. Next. So there are reviews which are based on prevalence of studies, and these are some of the prevalence study reviews which were done by our Center for Advanced Research in Evidence-Based Medicine at PGI Chandigarh, and this was about pneumococcal disease in children and also about distribution of serotypes for the vaccine for development for the use in children. And we know that pneumococcal vaccine has now been accepted as a national policy. Next one. Similarly, another review which has not yet found a place in the policy is that 2 or 3 primary doses of Haemophilus influenza type B conjugate vaccine are actually almost similar. So one has to see whether we need to give 3 or 2 doses of HIB vaccine. We are still giving 3 doses, but maybe someday it will change the practice. This systematic review. Next one. Then there was another review which has been done and which is again being done by our group, which was equivalent doses of intradermal fractional dose versus intramuscular full dose of inactivated polio vaccine for prevention of poliomyelitis. And this particular review is very interesting because it saves the dose of polio vaccine and makes it more economical. And this is, as we know, that now injectable vaccine, polio vaccine, is the standard of practice. Next one. So this review had actually included 13 RCTs involving a total of more than 7,000 participants, both children and in adults. And 9 studies were conducted in middle income countries, 3 studies in high income countries, and one study in a low income country. So this has got a kind of global implication. Next one. And conclusion was that there is a low and very low certainty evidence that intramuscular full dose IPV may result in a slight increase in seroconversion rates for all three types of wild poliovirus, and it was uncertain from the evidence body whether the intradermal fractional dose, that is one-fifth the dose, has been better in protective effects and causes lower adverse effects in children than the intramuscular vaccine. Next one. So this is how one goes about developing guidelines. There are groups which are guideline development groups. They look at the evidence and the outcomes which are coded in the PICO of a particular question. And then we conduct systematic reviews and we look at the outcomes across the studies. We create evidence profiles with Grade Pro software. We rate the quality of evidence of each outcome, and which can be high, moderate, low, or very low. And then we upgrade or downgrade the evidence. And I think this will be possible only once you've done a exercise of doing a systematic review and then applying grade to that particular review. We know that Cochrane has now undergone a change, and we have several evidence synthesis units. And in India, I'm the lead for evidence synthesis unit, and we are considering doing some prioritized systematic reviews in this. And these reviews are, earlier they used to go to the Cochrane Library directly, but now they will go to the peer review process first and then will get published in the Cochrane Library. So all of you who are interested in doing systematic reviews with Cochrane Evidence Synthesis Unit, you must think of some questions which are of high value and high application value. They should be of high translational value. They can be taken up as systematic reviews. Next one. These are some of the old things where we use Cochrane Library for the first time somewhere in 1997 or so, and then we published it in 1999, and these guidelines for asthma were developed. Next one. Then global strategy for asthma management and prevention also includes these systematic reviews. Next one. So there are several international agencies which are promoting evidence-based practice. These are Cochrane Collaboration, the Campbell Collaboration, the Jonah Briggs Institute, the Gessie Initiative, the Epicenter, and there are GRADE Working Group. All these centers are active in promoting evidence-based practice. Next one. So ICMR had sanctioned a CAR, that is Center for Advanced Research in Evidence-Based Medicine at PGI. It triggered a national interest in evidence-based practice. Pediatrics clinical practice underwent a paradigm shift. Niti Aayog also had set up a technical support units for collating evidence, and evidence synthesis units have been set up in NHSRC also for evaluating the existing evidence. Next one. So Cochrane collaboration, I think you should read about it, and you would come to know that Cochrane is undergoing a change now. And what changes are being made is something which you should be familiar with if you are interested in working with this body. Next one. So because in India, we have a Cochrane India network at the moment. And Dr. Anju Sinha and myself, we are co-chairs for this body. And Cochrane is a global independent network of over now about 50,000 researchers, where patients, carers, and even professionals, they become part of this particular body. Next one. And it's a non-profit organization with which is there in more than 120 countries and working together to produce credible, accessible health information that is free from any commercial sponsorship and other conflicts of interest. Next one. So this is the Cochrane logo, and I would just like to tell you the story of this Cochrane logo. The circle which is formed in the two C-shaped represents the Cochrane collaboration, that is C and C. The lines within it illustrate the summary of results from an iconic systematic review. And this systematic review was the one which actually told that giving antenatal steroids to mothers who had preterm labor leads to prevention of respiratory distress syndrome and saves these patients from developing respiratory distress and dying out of it. Next one. So the forest plot which is seen here is of all those studies, and it shows that corticosteroids given to women who are you're going to deliver prematurely can save the life of these newborn children. Next one, please. So this is how we make decisions. And nowadays we are moving from evidence-based medicine to value-based medicine, in which the patient preferences have also become very important, along with the research evidence and also the clinical state of the patient and the circumstances. And we know that patients prefer to have cheaper therapies, more economical ones, more accessible ones, and they are the ones, and also, of course, the more ethical ones. So, all these elements are also now being introduced into systematic reviews. Next one. So, this was T.S. Eliot who said, "Where is the wisdom we have lost in knowledge and the knowledge we have lost in information?" So we should not base our decisions just on information, and we must see what is the state of knowledge on a particular subject and then be wise enough to make decisions. I think that is the last one. Thank you. Thank you very much. So there are a number of questions which are there in the in the chat box.
Yes, ma'am. Yes, ma'am.
Yeah,
Thank
so you
you.
can do
And thank you,
systematic
Dr.
reviews.
Ling.
I'll just look at these questions. So you can do systematic reviews for drugs or cosmetics or medical devices. We can do for all of them. The difference between quality assessment of review and risk of bias assessment. So, quality assessment of a systematic review will also depend on the methodology of systematic review as it has been used, whereas risk of bias assessment is based after a review has been done, and then you see whatever the evidence is there, how good or how reliable that evidence is. So there's a slight difference, but of course, if the quality of the components is good, then the evidence is likely to be good. So those were the two questions which opened on my this thing. So that is all I have to say. If everything is fine, I can. Can we add observational study in systematic review? Of course, we can do systematic reviews of observational studies. The methodology is different, and the quality correct criteria, for example, there is a Newcastle Ottawa scale which is used in observational studies, and there are other scales which are used for diagnostic study reviews, like so quadas 1 and quadas 2. So you have to be actually learn all this methodology, which is sometimes also given in the handbook. Cochrane handbook is something which you all should read. Download it. It is available for free. And also have the RevMan software in which we enter the data for doing a systematic review. So can we add can we add observational studies in systematic review, or only? So yeah, you can do a separate one, but don't add them together. Don't add qualitative studies or observational studies to RCTs. Do them separately, but it can be done. So can we use same tool for both risk of bias and quality assessment? No, quality assessment tools are different because they are much wider, and they are the ones which are used to quality assess the studies which have been there. And risk of bias is a tool which ultimately gets applied to a systematic review. And if risk of bias is high, then the quality of review may be good, but the quality of evidence is low. So I think it is not possible to answer and learn all the questions in one go. You have to start framing questions, do literature searches, and start doing a systematic review, and then you learn all the nuances of systematic reviews. And we are very open to guide you, and our evidence synthesis unit is something which will always guide you for conduct of systematic review, and will also support you for doing literature searches on for systematic review. Do we always have to use Prisma? Yes, Prisma is something which is part of the methodology, and we should use it, yeah, to have it good quality. So in a narrative review also, because you, if you have searched literature and you have included, excluded, and you found what are the type of studies, then you should use it. Now don't call them narrative reviews. Now you, I think you should all go for systematic reviews. Narrative reviews are, the difference was that they are just people just do cut and paste sometimes of abstracts in narrative reviews. They don't synthesize them properly. So there are people who would write very good summaries of trials, etc., which are done, and sometimes those are the ones which are needed. So those summaries are something which are always valuable.
Thank you, Dr.
Thank you.
Meenu, for this insightful session and for sharing your expertise with us. Your valuable insights have provided a strong foundation for understanding evidence to policy for systematic review and meta-analysis in this workshop. Thank you, ma'am.
Thank you very much for inviting me, and I wish you all the best for this. Thank you.
Uh, So, moving forward, we now have another enriching session lined up with two esteemed speakers who bring a wealth of expertise in research methodologies, information sciences, and advanced data strategies. Today's topic for the workshop is incredibly crucial for conducting high quality systematic review and meta analysis, that is, search strategy for SRMA across different databases such as PubMed, Scopus, Embase, and Web of Science. So I would like to introduce our first speaker, Dr. Jagriti Sani. She is the founder of Eternal Restem, a startup dedicated to holistic faculty and student development. Dr. Jagriti holds a PhD in electronics and communication engineering from NITTR Chandigarh and is a gold medalist from Punjab University. Her expertise spans data sciences, IoT, and AI applications in research and healthcare. With over 40 publications, multiple international collaborations, and 300 plus invited talks, she continues to shape the future of research and technology integration. Without further ado, I now invite Dr. Jagriti to take over the session.
Thank you very much, ma'am. Good evening, everyone. We are here to discuss an important topic for today's case study, and that includes utilizing search strategy for conducting your systematic literature reviews. And I'm sharing my screen with all of you right now. So I'll be focusing on utilizing search strategies right now. And in this, basically, we have like plenty of databases that we have already talked about. It includes PubMed and then Web of Science, Scopus, and many other platforms are up there. I'll not be using PPTs right now, considering the time that we have. I'll be directly utilizing PubMed platform that will be covered by me, and the remaining databases will be covered by another expert further. And in order to lead this analysis, the very first part I'll include here is, for instance, starting with a topic in your mind, maybe a research question that you may have in your mind, and based on that, you pick up some of the key terms utilizing which you can conduct your analysis on certain database. So to start with, I'm considering here one simple query. Like for instance, we want to analyze excessive use of mobile phones as leading cause of depression among children. So you may have a query, something like this, from any of your research study that you are considering for your SLR. And in order to conduct now some research on your different databases to grab some relevant articles associated to this particular topic, you need a proper combination of keywords to be utilized. And while leading this concept, there are some specific terminologies that we prefer utilizing for this. The very first thing we recommend is you need to consider, for instance, first we will identify the key terms from our research topic itself. Like I can identify here, one is mobile phones, that is one of the focus from this particular study. And then we'll move forward with this depression. This could be another leading aspect in my study. So this becomes another text keyword. And then we are focusing on children group. So this becomes my third area of interest. These become your initial keywords to lead your search study. Now, when we start conducting analysis on the databases for this, like PubMed, I have opened up, and you might be aware that this is one of the most popular biomedical literature database, and it includes papers from Medline, life science journals, and several online books, etc. One of the most reputed platform we can have for the medicine-based analysis. And on this platform, we have directly available this search query. And here we can insert our combination of keywords. Starting with the initial terminology over here, for instance, I have identified these three as my keywords. So if I start searching utilizing any of these, maybe like I pick up mobile phones and I go to PubMed platform, I'll insert it right here and I'll conduct my search. So you can see whenever we insert a text keyword into the database, it will immediately bring you some relevant set of studies. And the keyword is highlighted over here. And you can observe this with reference to a range of years. That filter will be highlighted on the platform. Along with this, you will have information about like if availability of abstract or full text is there. So accordingly, some information you can select from these filters. And there are few essential set of filters you will find basically. When we are utilizing these keywords alone in this format, starting with the very basic search, like maybe when you are doing it for the first time and you have no idea how to frame your keywords to lead your search strategy. So if you are checking it for the first set of words over here, you can just try to explore what we have associated to these keywords. Like you can see, these are highlighted here. And maybe you can open up any of these platforms and then you can visualize further like what they are talking about mobile phones over here. So these highlights you will find somewhere in your article itself, including your title, abstract, as well as in your main study. Similarly, I can conduct this for my second keyword as well. Like I can choose here depression and I can run this directly over here. And this will bring you articles associated to depression then. And you can see the count of results is very high. And that will not fit into any of your SLRs because that is like a controlled set of studies you need to conduct SLRs over there. So the better way to assess this, instead of running these keywords individually, we try to combine them together to run our search on the databases. So what I can do for that is a step ahead I'll add here, and I'll combine these as mobile phones. I'll utilize the first set of operator as AND operator for this. We generally have three most popular operators that we can utilize: AND operator, OR operator, and NOT operator. Starting with the first one as AND operator. So I'll simply club all these terms with AND operator in sequence. Make sure the operators you place in capital letters because that is the latest update we have on the PubMed platform. It considers these operators in the capital form. And majority of other databases are going to follow the similar pattern as well. So I'll just copy this portion of keyword combination. I'll take it to my PubMed platform and I'll paste them right here as this combination directly to conduct my search. And you can observe we got a limited set of results with this combination, 239 studies. And when we start exploring it further, you can visualize here that these keywords are highlighted based on their presence in different databases. And here comes one more important analysis, that even if we are searching for mobile phones over here, it could highlight cell phones as well, because that is a synonym widely used on the platform. So from here, you will come to know about some possible synonyms of your technical phrases that possibly you can later on utilize in your search strategy. So this initial idea is to judge what kind of outcomes you are getting from your analysis. And on the next stage, maybe if you want to exclude any specific type of analysis from here, so for this, maybe I'll pick up this. And maybe I'll write here, not adults, just a random search I'm inserting here, not based on the relevant query that we need for this analysis. Maybe you just want to include children, but not adults. This kind of analysis also you can conduct. But while placing this not keyword, you have to always be very much careful whether this is going to be relevant for your outcomes or not. Because sometimes the analysis that is being conducted on children, maybe it will have something mentioned about adults also in the abstract part. So in that case, you are going to lose those studies, even if they are based on children-based analysis, but they have adult keyword somewhere in the abstract. So maybe they will be rejected in that case. So this combination has to be very thoughtful. You have to consider all the possibilities associated to your studies. So avoiding this example just I have given you. And along with this, now I have come to know that with this mobile phones, there are some possible combinations like synonyms, cell phone or maybe smartphone, etc. So for that, we can further improve our phrase. In order to put synonyms into your search query, we use or keyword. And with this, I can place here and smartphones. For example, by just analyzing initial set of studies from my database, I came to know that these three synonyms are widely utilized. So considering this, I'll just try to put them by the end for now, and I'll just explain this outcome also for you. These combinations and the AND operators. If I try to conduct a study based on this, based on these combinations, let us observe what we'll get. I'll insert them here and I'll conduct a search. And surprisingly, you will again find a very huge number of outcomes, 48220. And if you try to observe it further, you will see that there are some articles that are not closely associated to your initial search query that you were planning to conduct. That was based on an initial hypothesis or a search question. So reason for this is wrong use of or combinations. Let us understand this clearly now, because you can see here, although it is describing smartphone, but mainly in associated to addiction, not about children depression. Similarly, we can scroll below and it is showing some other details like screen time or mental health issues. Other than this, also we have some details here. So some of them may be relevant and others may be irrelevant, because the combinations that we have utilized are not perfectly done as per the PubMed requirement. So taking a step further with this, we add the parenthesis. That is a way to nest your synonyms together. Because generally on your databases, the reading process goes from left to right. So automatically your database will start reading from this depression terminology, and it will follow children and then mobile phones. And as soon as it receives the or, it will not be able to understand whether this is a separate or whether it is associated to this mobile phone synonym. So that makes a critical analysis over here. And for this, the better way is to nest your synonyms together. And we add a parenthesis for this that you can observe here. And as soon as I update my query with this parenthesis, you can observe the change in these results, and they will be more relevant now. So I'm conducting this analysis, and you can observe 447 results. So more relevant outcomes now you will find. These ones, if you can just check, they will be associated to your initial search question or hypothesis, more relevant to that. Further, we can improve it slightly, and that is possible with the next stage of query combination, and that we utilize with quotation marks. When there is a single word in your search phrase, in your search query, no need to have a quotation marks because that holds an independent importance in your database. But when you have a combination of words in your search phrase, we prefer using them along with quotation marks that we can put something like this. Like mobile phones, I can put inside these inverted commas. And similarly, cell phones, I can place within these inverted commas. No need to have a inverted comma for smartphone since this is a single word. What does it mean basically? Whenever this search will be conducted on your database, it will try to find this word mobile phones with connected set of words instead of finding them separately. So that makes more sense for your kind of analysis. And if I try to conduct this analysis on the platform, you can see I'll just replace this query on the PubMed and I'll initiate a search for this. So as an outcome of this, it will create new set of observations, and the updated results will be able to see soon on the page here. So now you can see little bit improvement in your outcome. More focused outcomes basically we are getting 368, and you can observe them again below, and you will see here that they are showing all your relevant set of keywords connected here, and you can analyze them further how well they are associated, and that definitely goes further with your inclusion and exclusion criteria. We are currently on the first set where we are just trying to extract relevant set of keywords from the system. And further, one more technique I can add, although there are many other ways also to upgrade your search queries, I'll add one more thing here. Truncation marks are also commonly used, and most of the time we use them for differentiating between your singular and plural platforms. For example, if I'm inserting mobile phones here, it will find mobile phones only, but maybe there is mobile phone also as an important keyword. So instead of using that separately, like instead of creating a separate or combination for singular terms, we can use truncation marks in the form of asterisk, and that we add right here before inverted commas. And if there are no inverted commas, definitely you can place it by the end here, like maybe for children, if you want to make it with maybe other forms of this version, that you can update with the asterisk sign. Similarly, for the cell phones, I can add asterisk sign over here. And this asterisk sign, this truncation marks can also help you to search with the root words. For instance, for this children, child is the root word. That will connect you further with children, childhood, and child itself as well. So instead of using this entire, if maybe this makes more sense for your kind of analysis, you can utilize it with this asterisk mark. That will include everything relevant to this root word. So that can bring you more relevant studies in the outcome. So I'll just pick up this combination and I'll replace it here on my search platform. And you can visualize what kind of outcomes we may get. Although this is increased, but reason behind this is earlier we were focused only on children. So maybe that was not able to concentrate on other formats of this root word. Same goes for these other sets wherever we have used truncation marks. So maybe with the previous query, we could have lost few relevant focus studies, but now with these truncation marks, we could improve that. So what outcome from this initial strategy we have obtained is from these keyword-based analysis that we have obtained. First thing is utilize and operator between unique terms. That is the first finding we are using. Similarly, at second level, add synonyms or similar terms using or operator. Then group or terms with brackets or parentheses. Next, we can have use double quotes around multi-phrase words or multi-word phrases, precisely we can call. And the last one is use truncation wherever possible. So whenever you have maybe some root words associated to your search query, you can improve it something like this. So these initial set of rules we have learned from your search query now. Moving a step further. Now, for instance, we will consider a specific scenario and we will connect it further with the mesh terminology that makes more relevant considerations for the medicine domain. Whenever you are conducting studies on healthcare or medical sciences, we consider mesh terms to be utilized over there. And let us understand how we do that. So for this, I'll consider one more scenario over here. In yesterday's analysis also, we might have used some questionnaires over there. I think there was one questionnaire about low sodium diet also that was included by Vinessa over there. So considering that RQ, maybe if we try to analyze here, develop a new app. Maybe we are considering technology constraint with our study. Develop a new application to help those with high blood pressure eat a low sodium diet. This could be your initial analysis based on what research question you have created in yesterday's session. So from here itself, if we try to create a wider search option, like initially it is with specific low sodium diet. And from here, if we try to gather the essential set of keywords, that will definitely include your low sodium diet. And then we may have like this application we are talking about. So that is based on your mobile app. You can specify this in your search terminology also in your research question, new mobile app, for example, we are talking about. And then third is about high blood pressure, or maybe blood pressure only you can consider. So these three things are your main focus word right now. So again, based on these terminologies that we have learned here, you can initially start with your query, considering that. But we want to improve it further, considering the mesh terminologies for this. So what I'll do is, I'll take it one step ahead. I'll first broaden this particular search query in a precise way to improve my outcomes. That is based on your domain knowledge, basically. Either you take help from your supervisors to conduct this or your peer groups if you are a complete beginner, that how you can improve your search query. So for this, what I'll do is, I'm writing here, develop a new mobile app or a new app only to help those with high blood pressure eat a healthier diet, for example, because that makes sense as a initial search question. Or if we need it specifically in the form of a question mark, I can improve it like, how are mobile phones app helping individuals with high blood pressure eat a healthier diet? So that will become your perfect research question to lead your search now. As soon as we have identified this, now again, we can start setting up our concepts from here. That will be your key phrases from this particular question. And the better way to lead this analysis is you prepare a Word document side by side. Like I'll show you a quick strategy over here. We insert our research question right here, and then we deploy our search terminology step by step. So first I'll write here concept 1, then concept 2, and then concept 3. For example, I have 3 important terminologies to consider from this particular analysis. So that will include First one with maybe I need to consider mobile apps. So this I have inserted. Second concept based on what we have done in the previous query. Accordingly, I'll add here maybe either diet or healthier diet. So better terminology we can have as a standard term diet over here, because we need to improve diet of the person. The third concept we have here is about blood pressure. So you can use high blood pressure or blood pressure as a common terminology. So we will first pick the common concepts that we will have around this. And then in order to find relevant set of keywords, again, the similar approach you can follow that I have used earlier. Like we can conduct analysis here for maybe mobile apps or mobile application. So if I run this, I can find some relevant set of words that are being utilized for this. Like mobile apps is a common thing I can observe. I'll click on some of these and then I'll try to find what are other options used. Mobile apps, I can consider one option. Then I'll just search for maybe with a singular terminology and I'll insert this. So as I insert mobile app, so I can observe this is also a commonly used keyword. And I'll scroll down to a number of studies to understand if this terminology is widely used or not. And somewhere you will find something like this. You can see mobile application. So this could be also relevant. Similarly, if you try to observe it further, somewhere you will find things like mobile healthcare also, because that is another common terminology being used in your sector. So we can observe things further, and based on this, we will create our initial set of keywords. That will definitely be from this search only. So whatever I have observed from here, like these kind of things, you can click on these applications and then you can find your essential set of keyword lists from here. So what I'll do is I'll create my keywords for first concept. That will be mobile application or mobile applications. I'll precisely use it in this form, plural and singular. Similarly, we can use maybe mobile technology. Again, you will do some analysis on this. Considering the time limit, I'm not conducting the detailed analysis, but just by visualizing those articles, you will find these details, that these are the relevant terminologies. Similarly, one more thing that you may observe commonly is mobile healthcare. And sometimes it will also include mHealth. This is another popularly used keywords you will find in the database just by running a query for this only. So initially, just the concept we have identified and set of keywords we have identified. Same you have to do for the diet also. I'll insert the keywords over here. Currently, we are using text keywords only, not mesh terminologies. I'll use a step further for the mesh terminology also. So what I'll do here is I'll insert this diet into search and let us see what we get as an outcome of this. So diet is a commonly used word, and then we can move forward with some other details also associated to this. You can run it below, and this is one of the most commonly used keyword. So we can verify that we are on the right track. This is a commonly used platform. And in order to be more sure about this, one more thing you can add is like another commonly used keyword you will find is maybe nutrition, because that is also relevant to your work. So based on this, we have verified that diet is a possible keyword that I can utilize, and other I can try is nutrition. Again, based on your domain knowledge. So this is my third concept, and I need to use my keyword combination for this as well. I'll run this part. And for blood pressure, now, if you just evaluate your search database, same as what we have done previously, two terminology we can find. One is high blood pressure and other is hypertension. These are two common terminology out there. So now text keyword analysis we have done. We are ready with the concepts. Now we need to move one step further with the mesh terminologies. We'll use combination of that on the PubMed database. And for that, I'll again go to this PubMed platform. And here we have options. One is mesh database you will find right here on the home page itself. Other technique also I'll show you further. First, let us start with a very simple word, like maybe hand washing. Just a very simple term I'm using. Hand wash we can use in day-to-day life. But how in medical terminology this thing may be used? I'm just picking this keyword just to show you impact of mesh terminology. I'll just initiate a search for this. And you can see I get results with this hand washing. But when I need to know about mesh terminology for this, your mesh terminology help you to get medical subject headings that are more relevant to the medicine domain. And we prefer considering articles that are more closely associated to your mesh terminology because they make impact into your studies based on this. So for this hand washing, what I'll do is maybe I'll open up any of these topics, any random topic I'm just picking up. And from here, I'll get this highlight on PubMed. This is by default available, mesh terms. As soon as I have opened up any of these, I'll just go to mesh terms from here, and you will observe that what are the commonly used options for this. And you can see here, itself it is written, hand disinfection. This is one commonly used term for hand washing. And the same thing we can verify from your mesh database as well. So initially, if I just go to this mesh database, and here itself, if I search this hand washing, I'll initiate search, and quickly you will find your key term utilized in medical database for hand washing. This is how your general keywords may differ from the medical domain specifications that are already provided in your literature. And these mesh databases are updated year after year with new set of advancements in the domain. They keep on updating, so accordingly you can find their connection with the existing studies. And then we have another set of entry terms you will find here, and below this we have the set of mesh categories, and this is the main highlight we have identified from our literature. Now this goes with all set of concepts that we have added into our database, like here also we have added. So for instance, I'll copy this mobile apps and I'll go to this mesh database and I'll try to search this directly, mobile apps, and I'll run this search. So as soon as I run this search, you can find mobile application is the main term being utilized for this mesh apps keyword. And if you just try to observe it below, you will find other things also. Like these are commonly used options. Some of these are inverted collections also, but we generally do not prefer inverted collections. We prefer direct connections, so that you will find as mobile application. The reason being because this mobile application is a connected word that you can easily find in databases or in published papers. You will rarely find these inverted forms directly in your papers. So better to use these direct connections from your keywords. So for instance, this mobile application is one of the most relevant mesh terms I'm getting, and I can insert it here like into my search builder. You can observe this side, PubMed search builder, just to know how I can represent it as a mesh term. So I'll write here directly, just click on add to search builder. And as soon as I add, this is the format I can use for mesh terminology over mobile applications. I'll just copy this part and I'll insert it here as my mesh terminology. So you can see for the first concept, I have created this. Same I'll use for the second and third concept. And for this, for instance, I'll pick up directly this diet into my mesh terminology database. I'll pick up this and I'll go to this search menu directly and I'll search this. And from here, you can see these are relevant set of outcomes we are getting. And as I proceed further, I'll find here one interesting term, that is diet therapy. So based on your domain knowledge, whichever of these you find more relevant to your study, that you can utilize. For example, based on my analysis, I consider this diet therapy as more relevant to my research question. Since I'm just planning to do something like this, I need to plan healthier diet for the patients. So that will be a kind of diet therapy. So if I consider this as my relevant term, I can enter inside And here I can find every relevant information about this entry term along with what is included within it. So you can see right now my diet therapy is at this position. So anything below this, everything will be included if I conduct search with the term diet therapy. And we can even control this part. You can see this filter here. Do not include mesh terms found below this term. You can use this. If I turn this on and then I try to add this into my search builder, you can see this is added something like this. And it says no expansion. If I do not include terms separately below this. But in most of the cases, you would like to include them separately also. So what we can do is we can simply uncheck this and then we can build our search. So this will be my mesh term for the second concept that I have in my database, and I'll just place it here. Similarly, I'll proceed the third one also. So I'll pick up my concept from here and I'll go to PubMed database right here. I'll initiate a search. And from here itself, I'll get my mesh terminology. If I scroll down, this hypertension I can find from here. And maybe if this sounds more relevant, we can click on this. And we can find all associated subheadings with this PubMed search. And you can find these are the terminologies included with this hypertension word. And if they make sense for your kind of study, indeed, you can include this as your database part. So I'll just add this also to my search bar, and I can copy this to create my mesh term for the last element. So now I have incorporated all these elements into my keyword collection. Now the next part we have is to conduct queries on the PubMed database. And for that, what I can do is I'll just use combinations of and, or, and these keywords and mesh terminologies together to conduct my search. And for that, what you will observe is, for instance, for these kind of things, first, based on the initial understanding, what I can do is I can, okay, first I'll just copy this portion and I'll place it here. And here I'll make a little bit of changes based on what we have understood till now. So from this mobile application and mobile applications, I can use asterisk sign over here and I can enclose this within inverted commas. Similarly, for mobile technology and mobile technologies, both keywords, I can use my asterisk sign over here. And then I can utilize inverted commas because this is again a two-word phrase. So here also, if you need asterisk that you can use, otherwise you can use your these inverted commas directly. For this, we don't need any inverted commas or asterisk sign, so we can use it as it is. Now further, I'll connect it with or combination because that we know that these are all synonyms only. So I'll use this with or terminology. This is the first step. Then second thing I'll do is I'll pick up this mesh terminology and I'll insert it here, and that too with or, because this is also a synonym but from the mesh database. Taking it one step further, what we can do is while combining this, now for the mobile application mesh terminology we have added. So it is written in these square brackets that first one is mesh terminology. For these remaining ones, we can add TW tag, that is text word tag, that makes your query more relevant based on the protocols that we follow on PubMed. So I'll write here TW with remaining all words. That indicates text keyword. So this combination now I can utilize on my first concept. Similarly, I can improve my remaining concepts as well. Like for this, I have diet and nutrition. If you can create some asterisk signs for this also, like diets or anything, dietary or anything like that. So you can update the asterisk sign with this. Similarly, I'll use or. And for nutrition also, if your asterisk is applicable, that you can add TW, that is your tag we will add for the text keywords. This also is updated. And then the mesh terminology in front of this also I'll update again with the or combination. So for the second concept, now my search is ready with OR combinations. Going ahead with the third one, here we have utilized hypertension as your mesh terminology. So that we will considering here with the keyword combinations as well as with your mesh combination that I may have not copied. So I can take it from here and I'll place it right here with OR combination. I'll place this within inverted commas. I'll add OR here. And this one also I'll insert, this will not require, but this will require TW tags. And here also I can insert TW tags. So this makes my third concept in the search strategy. And if for any of these you need asterisk signs, accordingly you can use. Maybe for hypertension, such as if you have any possible asterisk sign combinations that you can use, considering your base words. So that is possible. Currently, for these three concepts, now I'll lead my search on the main database. So what I'll do for that is, I'll first run individual search. I'll show you how we can combine it. You can combine it initially also, but I'll show you one simple way to understand the differences between these. So PubMed, I'm going back to, and here I'll initiate search with these combinations. This I'm searching right now. We'll wait for the outcomes and then I'll go to this advanced search. You can observe here, I'll go to advanced search. And here you can observe the count of results. And this is what they are bringing us. And this is the search number. These previous search numbers are also listed in my search history right now. So this is what I'm getting initially. And these are the combinations that are working on the background. And you can see everything they have used clearly with the combinations that I have utilized initially. So you can even delete previous search history and you can use the specific ones. That is also possible. Like I can clean previous search history. I can put my recent query here so that you get the specific results only. And from here, I can check your this initial query from here. Similarly, I'll pick my second search query as well. These outcomes I'm seeing for the first concept. The second concept I'm picking up. Initially, I have 30,159 results from the first query you can observe. Then I'll use my second search query. I'll run this part. And we can visualize this again in the advanced search. So this is resulting 1 lakh plus outcomes. You can see a very big number again. So this is with your second query and you can visualize how it is working behind. So this is the combination that they are utilizing on the database right now. Similarly, I'll pick up my third query and I'll run my search for this as well. And I'll just place it in the query box. I'll run search. And again, I can check this with advanced search and you can visualize here. This is the count we are getting. So currently this is with individual concepts we are getting outcomes. But in order to get precise outcome for your analysis, because you are considering all these factors together in your research question that you designed initially. So for this, what we can do is we can just combine all these with AND terminology. I'll just pick up these numbers. You can see #1 is my first combination. I'll combine it with the AND combination to my second keyword and then AND combination with the third search that I have used. As soon as I combine them, I can search it together and let us see how our results are improved. You can see 113 results that are more focused on only on your research question now because we have the combination. You can see hypertension, M health, hypertension, all the highlighted keywords that you plan to use initially. And now they will bring you the most relevant set of outcomes that you need to conduct your analysis. So this is how your initial search query may work. And whenever you have conducted this analysis, save this file so that in future also when you are reviewing your paper, maybe some troubleshooting is required, you can refer to your keywords accordingly. Just to answer your reviewer queries also, you can utilize these queries at how you are justifying your collection of papers. You can even put them in tabular form, like with individual concept and then the combined concept. You can create a table and then you can present that within your systematic literature reviews. So with this, I'll just stop here because on PubMed, I have given you plenty of information and I hope this is relevant to start with your initial search strategy. And I suppose it will be continued further with another expert of the day, and they will be helping you to understand it on the remaining set of databases. So thank you very much. I hope I could deliver you some relevant details after this.
Thank you, Dr. Jagriti, for sharing valuable insights. Your expertise has provided us with a deeper understanding of effective search strategies across PubMed database. We truly appreciate your time and guidance in this session. Ma'am, also there are some queries from participants. I would like to request you please address them. Ma'am, there is one question. Does space between two words matter? What if we want to include depressive disorders as well?
Space between two words you want to consider. So if they are basically by default, they are two words. So that is why we are including them within inverted commas. If by default that is a single word that you can include together, then there is no issue. But if technically it is two word combination in your phrase, then those inverted commas are presented for that purpose only.
Okay, ma'am. Another question is low sodium and diet should be different mesh terms or can add as a single one.
When you are considering low sodium as your specific keyword that you want to consider, you can put them as separate mesh terms also. There will be not an issue. That is completely on what kind of search query is bringing you best set of outcomes. I'm showing you just initial analysis that this is how you start. But then we try it with different combination of keywords as well as mesh terms. And we just finalize the ones that bring you the most relevant set of outcomes.
Okay, ma'am, another question. Does using truncation within quotations work on PubMed searches or should it be used outside of codes?
Truncation we generally prefer within quotation marks. So that is on the PubMed database. That is with the updated repository instructions you will find. Within inverted commas, we prefer it.
Another question, why don't we directly use mesh terms for finding keywords?
Because there are two things here. Keywords that we are using initially, they are commonly used phrases anywhere you can have, and mesh terms are more associated to the your medical databases. We are just using a combination of both to ensure that most widespread literature we can cover up with this. There you will find many search where people are using only mesh terms only. That is also possible, but the best recommendation is that you use a combination of text keywords and mesh terms, so that even if something is missing with the mesh terms, because sometimes what happens, like some recent articles may not be included in mesh database. Like for instance, augmented reality is one technology that is being widely used in your medical domain these days, but it was included in mesh terminology in year 2019. So if you need something before that, that was using that technology, but it was not updated in the mesh database, so in that case your text keywords may help you. So a combination will ensure widespread coverage in that case.
Another question is there any specific technique to find keywords related to the concept other than basic domain knowledge?
You can also conduct search on the database that I have already shown you. Just you try to run your basic text keywords on your search and then open up the abstract and title of different papers, and there also itself you will find the most highlighted keywords associated to your word. Like I have shown you with search on mobile app only, that was showing some mobile phones also, mobile application as full term. Cell phone also will come and smartphone will also come. So from there only you can build up your relation, considering all the relevant terms from there. For the text keyword, this is easy to do. For mesh terminology, there is a specific mesh database that you can utilize.
There is another question. We have to mention both keywords and mesh terms in our review.
Yes, you have to put that precisely. Exact combination that you have used, you should put that either in a table or in a proper search query that should be presented within the your methodology part.
Last question is if we have added hypertension in mesh format, then why we are adding hypertension in TW also.
Yes, that was just because hypertension is more popular in your text word community also. So that is why both I have added. Although majority of search again you will find with mesh terminology also if it was updated at early stage. But reason is same. If some articles are yet not covered in your mesh database, but they still have hypertension concept, so they will be taken up from the text keyword in that case.
Okay, thank you, ma'am. Thank you, Dr. Jagriti, for addressing the queries. I hope the participants found explanations helpful and gained clarity on their doubts.
Thank you very much,
Thank you,
ma'am.
ma'am. Thank you. So now I would like to introduce our second speaker for today's session, Dr. Harpreet Singh. She is a distinguished expert currently serving at the University Business School and the Center for Distance and Online Education, Punjab University. With 17 years of experience in academic libraries and a PhD in library and information sciences, she specializes in research methodologies, systematic searching, and academic resource management. Dr. Harpreet has published extensively and has been recognized for her contributions to research orientation programs and mentorship in dissertation projects. Without further ado, I now invite Dr. Harpreet to take over the session.
Hello. A very good evening to all the participants. Am I audible?
Yes, ma'am.
Okay. Thank you, Priyanka. So much has been said and much has been put into your notice from yesterday's class and from today's. I'm first of all thankful to the organizers and Dr. Jagriti for making my work very easy now, because she has totally elaborated the search concept about the basic search, advanced search. So I will be taking it further to further level regarding the search in different databases. Just give me a minute. I'll be sharing my presentation with you. Is my presentation visible now?
Yes, ma'am. Yes, ma'am.
Okay, right. Thank you. Right. So we will be talking. Sorry. I'm here to make you aware about the search strategies for literature in systematic reviews. And I just wanted to bring it to your kind notice that I was a part of the ICMR Advanced Center for Evidence-Based Child Health under Dr. Meenu Singh for 2.5 years. And I was a part of the core team. The reviews that were shown by Dr. Meenu Singh in her slides and presentation. I was a part of that, and I was the person who was doing the searches and making the search strategies for those reviews. So if anyone is interested in carrying out a systematic review and requires a help from my side in creating a searches or running the searches, I'll be available for that. Right. In my presentation, I'll be talking about understanding the systematic reviews, designing a literature search, and conducting. It's going to be just a brief of all what we have learned yesterday and from today's session. Just make a quick revision about the things. For that, systematic review is basically a methodological and comprehensive synthesis of the existing research. Research has already been done on the specific topic. We will just summarize the findings to give evidence-based conclusions. And it is one of the important aspect of the research field to make evidence-based, robust, practical decision and policies. These searches, these things really help the policy makers to take decisions for that. Ma'am has already told us about that the CBNAT test for the tuberculosis final detection was guided by one of the systematic review done by the ICMR Center. The systematic reviews are of basically five types, but the major types which were put into practice, the narratives and the meta-analysis. Qualitative overview are called narrative reviews, and meta-analysis, they quantitatively combine the data of the multiple studies to get more precise estimates, like the likelihood ratio about this, the happening of some intervention. If some intervention has been given, what is going to be the likely, either it will be false positive or it will be false negative. Such kind of things, they give an accurate power to your conclusions. Literature search strategy. Designing a search strategy, the very first step that is required is what is the topic and what type of information, I mean the type of literature I am going to search for that. There are different kind of databases which are going to help you out for conducting a systematic review, but it is up to the topic, I mean up to the research question we are going to take, and the type of the intervention and the type of conclusions we are going to get. I have just listed few databases for your reference. To get a quick review of the topic, you can use e-medicine up-to-date database. For drug-related queries, because somebody has posted a question in the search box, can systematic review be done on the drugs? Yes, it can be done. We have the clinical keys, we have this Embase with us, we have MD Consult, we have drugs at the rate of FDA. These are the databases through which our queries related to drugs can be answered. And for the extensive review, the Cochrane Library of Evidence-Based Medicine is the gold standard. Systematic reviews are called the gold standard of the publications, and gold standard of publication of any system. PubMed is always there to search, help us out. All the time, PubMed is there for us. There are gray literature and other sources also which are not documented in reputed journals, like the conference reports, the thesis. They available information which can give a deep insights into the topic. For that, we can go for the official websites. We can go for the BMJ evidence-based medicine, TRIP medical database, evidence-based clinical research, and mind searched for evidence-based research. The Agency for Healthcare Research and Quality, it's AHRQ, that can be searched for getting the inputs about the healthcare. Clinicaltrials.gov, the Clinical Trial Registry of India, they are the sources. They can be taken into consideration while proceeding to the step of literature searching for a systematic review. Scopus and Web of Science are also there. Both Scopus and Web of Science are the abstract and the citation database. They can help you in guiding the studies, but they don't have that terminologies what Jagrati ma'am has already told us about the mesh terminology, right? This is a difference between the databases of which are specifically inclined towards the medicine or the medical field, because Scopus and Web of Science, they provide us information about the social sciences, humanities also. Next, the literature search strategy. There are basically two kinds of searches that are to be performed versus the basic search, and the another is called the advanced search. Basic search, she has already described in detail. You have to identify the keywords and you have to put quotes to make them phrases. Somebody has asked about that when one needs to set mobile apps. Is it necessary to put this mobile apps in quote? Yes, it is necessary. Otherwise, by default, the databases, even the PubMed, they search the two terms with the OR operator. OR means 2 multiplied by 2 will give you 4. Everything related to the first term and everything related to the second term. But if you are going to put quotes above these two terms, it will make you that term a single phrase, and the database will search the term as a phrase. So identifying the keywords, making them phrase, to get a comprehensive coverage about the subject, and synonyms and variations can also be taken into consideration with this. You are going to perform your title search, TW, and a title, it's TI for abbreviation for that, and text word is also there. Subject search, subject means you are performing a search for that particular topic using the various subjects in which that term can be used. Subject search can be done through mesh subject headings in PubMed and through entry in the Embase database. Suppose I need to search the topic of, I'll take this example, topic of cancer. Cancer is a very common phenomenon, right? But in the medical terminology, malignancy, benign tumor, neoplasms, they are the terms which are subjectly specified in the mesh that can be used for the term cancer. So while performing the basic search, one has to be clear about the keyword which is in the common parlance and the subject specific word which we are going to take with the help of a specific database. Next comes the advanced search. Advanced search uses the Boolean operators and or not, very precisely and elaborately described by Dr. Jagrati. Then truncation. To search the root form of the word, we have to apply truncation, wildcard for spelling variants. At times, the spelling variation is a very common thing which we face these days. COLOUR is colored, COLOR is colored. One is in the British English and the other is American English. So, to avoid that thing, we can use a wildcard. It can be a question mark, it can be an asterisk. Stemming, if you are broader searching the word variations, suppose I'm searching educate, but I want that something related to education, educational techniques, education aids will also come. I use the advanced search option of stemming, and then range searching. What type of range? You are going to cover the articles or the journals or the literature published in the last 10 years, last 20 years, or you want only the systematic reviews, or you want only clinical trials, or you want only peer reviewed articles. These all search ranges are mentioned in one or the other database, either on the left side or on the right side. So advanced search requires all these things to be taken care while performing the search for a systematic review. This is the first database I just wanted. I'm showing just one or two screenshots of each and every database so that you get familiar that what kind of interface you are going to see when you open that database. First is the Scopus. It is an abstract and citation database by Elsewhere, and it is a subscribed database. It's a paid database. It's not free like what we are doing with the PubMed. It's not free. It is a subscribed database. Once your organization has the subscription of this database, then only you can start searching over there. You can see the different kind of fields are present for searching. You can search for the article, you can search for abstract, you can keywords, first author, second author, affiliation, funding agency. Suppose you want to search the articles published by ICMR as a funding agency for any particular topic, then you can just specify the funding sponsor and do the search over here. The next, I have searched the term cancer, CANCER, within the article, title, abstract, and keyword. I have got near about more than 42 lakhs 86,141 documents for the term cancer, article, title, abstract. Mind it, I have told it earlier also that these kind, the Scopus, Web of Science, these databases, they do not have the medical vocabulary or the controlled vocabulary. They'll search within the ranges that are available with them. This was the range. That means author, first author, source title, the funding, and something like that. They can only search with the text words you are going to provide with the text, I mean the search box. The filtration present in this database is the subject area. I want something related to cancer for medicine, for pharmacology, toxicology, and pharmaceutics. That means something related to the drugs or the medicines used or the different type of repercussions of the medicines for the term cancer. These are the subject areas that can be filtered from the results. 42 lakh results can be filtered with the use of this subject area. These are the broader subject areas minded. These are not the in-depth indexing is there, because this is a paid database which basically has the abstract and citation. We normally use this database for the checking the X and H index, impact factor, or the author productivity of this. But nowadays, Scopus is also being used for conducting searches for the systematic reviews. The next is the Web of Science. Web of Science has 5 more databases collections through which the search can be done. It is Korean Journal database, it is preprint citation index, it is the Brookquist dissertation database, and there's a CELU citation index. Web of Science has this much all in the collection. It is by the Claveriate. It is also one of the subscribed database. You can search journals, books, proceedings in sciences, social sciences, arts and humanities with the full citation on Web of Science. See, these databases, if you are going to perform the search and you are not very familiar with the basic or the advanced search, they are going to help you out by giving the examples. The same term cancer has been searched in the topic field of Web of Science database. It is going that the topic will search title, abstract, and index, and it is giving the example of an asterisk mark of the phrase also. You can search by title, author, publication, year published, publication date, abstract, like this. The same term has been searched in the Web of Science database with all the 5 databases. You can see the results are only 38 it says yes 38 lakh 24,494. Earlier it was 42 in the Scopus database. Because I have added a filter of preprint citation index is not included in this, and Web of Science give me helps about the quick keywords that can be used. Cancer incidence, breast cancer, cancer registry, secondary primary cancer screening. This is the difference between the 2 databases, Scopus and Web of Science. It has given me an option of adding quick keywords. They are not mesh terms in. Please make sure I'm repeating the thing that they are not mesh terms. They are just the quick keywords that can be added while searching Web of Science as a topic in the cancer. Right? Coming to the next, we have the Embase database. Embase database is one of the database that is more relevant along with the PubMed for conducting the systematic reviews, because this is the database that will help you in making quick search. You can conduct your search by following the PICO strategy. You can search for the drugs, you can search for the disease, you can search the M tree also. Similar term cancer has been put for searching in the Embase, and Embase using its M tree is giving me option. You can use malignant neoplasm, you can use chemotherapeutic agent, you can use cancer therapy for cure, for healing, for remedy. This is giving me the options because the medical controlled vocabulary M tree is at the backend working for this database. See the PICO format. You can build your search using the PICO framework. You give the population, give the intervention, give the comparison, give the time. PICO framework search can be performed on Embase database. Next, Embase, if I use the advanced search strategy, using the M tree of this, cancer gene therapy, it has been searched, given an example, map to the preferred term in M tree. search the free text in all the fields, explode using the empty terms, search as broadly as possible. Like we have done for the PubMed, we use the keyword terms in the simple text words and we have used the mesh. But Embase has the built-in database, built-in programming that it can use your free text available, it can use the preferred terms, and it can explode to the narrower terms for that particular topic. And the mapping is there. You can use it for the publication types, you can use it for the gender, you can use it for the age. I don't have to put the children over here. I'll simply drop down menu, use the term a drop down menu, the title age, and select for how much age to how much age my search is going to be limited, whether I am going to use it for the infants, whether I am going to use this for the adults, or sorry, the infants, the adulthood, or the any other age group is to be mentioned. Whether I want to perform this search only for the females, I am searching for the breast cancer, who limit my search to females only, not to the males cancer, right? This is the beauty of this database for searching literature related to the systematic review. I mean, everything is on your home screen only. Again, a subscribed database. If your organization has the subscription, then only you can perform the searches on Embase. Next comes Ovid Medline, another product used for systematic searches. The another feature is that it has multiple type of limits with this. You can use for structure abstract, you can use for the journals, review articles, latest updates, and PubMed, this Embase and Ovid Medline. They will give you the search strategies on the home screen. You will create your account, download the search strategy, and give it as it is to the journal to whom you are going to submit. And even for the while the protocol development, you have to mention certain keywords and certain searches while development of the protocol you have that you are going to use. The same thing can be copied or downloaded and with any of the reference manager, or you can simply download the Word or Excel or CSV file and post it on your protocol and on your review. These databases, they do such kind of things. The Ovid Medline searches from 1946 to the current date. Ovid Medline and PubMed Medline, these are the two things. This question might arise for you, that what when you have PubMed Medline, then why you are searching for the Ovid Medline? I just wanted to make this clear that Ovid Medline and PubMed Medline are the same kind of things, but there is not going to be 100% same Medline searches the citations created by the National Library of Medicine, including ebooks also. The interface of searching the both the Medlines is different, and it is provided by two different agencies. While performing the same search, cancer, in the search box, I got this much result, 82,821. I have added that cancer including the related terms. Including the related terms means the malignancy, the neoplasm, the chemotherapeutic drugs or chemotherapy also. The related terms to this word has already been included while searching the cancer in Ovid Medline. Different databases have different search interfaces. I mean, you have to just explore and use that kind of database to finally make your search strategy. When another search I have performed is cancer with MP or exploding neoplasm, exploding or expanding the cancer as a multi-term with neoplasms, expansion with neoplasms. The results have increased from 82,000 to somewhat 44,72,692. I have just broadening my search so that everything related to the cancer as a term, including the synonyms, including the variations, can be there. Yes. Coming next, clinical key. Another database which is very useful these days, and it can be used for the disease conditions, for treatments, for drugs, for books and journals. Drug monographs. MBase is always there. If you are performing a systematic review for the related to the drugs, clinical key is another source that can be used. You will get the clinical trials, drug monographs, you can get the patient education for point of care of something. If you are a doctor performing your duty, regular duties for the point of care of something, you can use these database for your day-to-day working also. While searching the same term, clinical key, I have got around this much articles related to this. Full text only has been marked, clinical trial has been marked. Clinical trials should not be ignored while performing the systematic review thing. Clinical trial needs to be included because sometimes you can come to know some very interesting fact about the ongoing clinical trial or the trial which is about to submit the results. Meta-analysis paper for the cancers are 164 to 67 clinical trials that has been published for their outcomes are present in here. So clinical key, another source to be taken into consideration for the systematic review searching. TRIP database, it's a free database. You don't need any subscription like you are going to have for clinical key, for Embase, for Scopus, for Web of Science. This is a very fast clinical research evidence, and you can perform any kind of searches for the your systematic review. Even the pico search is there, but for going for the advanced search, you are supposed to get the pro version. Advanced search can be performed in the search terms because you are well aware with the and or not, phrase, truncation, stemming type of search operators by now. Similarly, this is the result. It is showing that this much systematic reviews are there, evidence-based synopses are there, the guidelines for certain countries are also there. You can put your filters of date to be put. That means I want something related to cancer from the year 2000 to 2025, not beyond that, because I have restricted PCOT, the time of your search is to be there and the time for which you are conducting that kind of thing. Time here, that there are two meanings of the time you are going to take for performing and the time period you are limiting your search. The gold standard of this is called a gold standard because this is the first of the thing for which the systematic review got its real sense. Ma'am has also told us about that, that the Cochrane library is the first which has started the concept of systematic, and it has given review manager software in which the protocol for a systematic review can be researched, and the final, it is the software that has been maintained and developed by the Cochrane only. You can browse the different Cochrane reviews by the topics and the calls. They are the basic topic areas through which the Cochrane reviews can be searched. While performing a search, Cochrane review needs to be searched. That means the maintaining a search strategy, different databases is to be included, and Cochrane libraries also is to be taken into consideration, that whether such kind of review has been done or it has been noted in one of the leading journal, or Cochrane you have to keep in mind that you also. Yes, cancer in Cochrane as a topic, 853 reviews done, 190 clinical answers are there, and have used the same terms to show the search in different databases. Yes, this is one of the review done by my team, smoking cessation interventions for pulmonary tuberculosis in treatment outcomes, way back in 2016. I just wanted to show the databases that had been searched for this Cochrane review. We had searched the Cochrane Library, Ovid Medline, PubMed Medline, Embase, ISI Web of Science Conference Proceeding, Clinical Trials, WHO Clinical and International Clinical Registry, Meta Control Trials, search engines, Google Scholar, Trip, your review a complete set of paper which needs to be published and which will give something to the discipline. You have to search multiple databases, and while searching, Prisma can be made through this only. I mean, search from 1 2 3 database, this, the duplicates are this, then extraction is done from which all studies are found to be eligible. Database resources needs to be mentioned with the final writing project. Even for the protocol, you have to define the type of data resources you are going to search for your review. This was the Medline search strategy. We have performed the meta-analysis, and for the clinical trials, the placebos, the retrospective studies, all of these have been used. Adjacent and near, the proximity operators were also taken into the consideration. I'm extremely sorry, I forgot to tell you about that. I'll make sure that I'll add it in my presentation when I'll submit the presentation to the organizers. The Embase search strategy. SH means subject heading. TI means the thing has been searched in the title, in the abstract. Smoking cessation, MP, multipurpose, I mean, the word has been exploded to the multiple dimensions. EXP, smoking cessation or smoking cessation program. You have to explode that term. Explosion of the singular term is needs to be done so that everything related to that particular thing in your search. Thanks.